Communication is the process by which information is exchanged between individuals through common system of sign, symbol or behavior. Communication refers to the reciprocal exchange of information, ideas, beliefs, feeling and attitude between persons or among a group of persons. Communication process. Sender, who sent the message. Encoding, turning thoughts into communication. Message, content of communication. Channel, medium through which message is conveyed. They are visual, auditory, tactile, combined. Receiver, who received the message. Feedback, return message given by the receiver. Therapeutic communication definition. Therapeutic communication is an interpersonal interaction between the nurse and the client during which the nurse focuses on the patient's specific needs to promote an effective exchange of information. Goal of therapeutic communication. 1. To establish therapeutic nurse-patient relationship. Point 2. To identify client's most important needs. Point 3. To assess patient's perception of the problem. Point 4. To facilitate the patients to ventilate their emotion. Point 5. To identify client's strength and weakness. Point 6. To assist in identification and resolution process. Principles of therapeutic communication. 1. The patient should be the primary focus of interaction. 2. A professional attitude sets the tone of the therapeutic relationship. Point 3. Use self-disclosure cautiously and only when it has a therapeutic purpose. Point 4. Avoid social relationship with patients. 5. Maintain patient confidentiality. Point 6. Assess the patient's intellectual competence to determine the level of understanding. Point 7. Implement interventions from a theoretic base. Point 8. Maintain a non-judgmental attitude. 9. Avoid making judgment about patient's behavior. Point 10. Avoid giving advice. Point 11. Guide the patient to interpret his or her experiences rationally. Therapeutic communication techniques. 1. Listening. To listen actively is to be attentive to what client is saying, both verbally and non-verbally. Several non-verbal behaviors have been designed to facilitate attentive listening. Listening to the patient. S. Sit squarely facing the client. O. Observe an open posture. L. Lean forward toward the client. A. Establish eye contact. R. Reflective listening. 2. Broad opening. Here the nurse is encouraging the patient to select topics for discussion. Example: Nurse, what are you thinking about? 3. Restating. Repeating the thought expressed by the patient. Example: Patient, my mother left me when I was a 5-year-old. Nurse, you say that your mother left you when you were 5 years old. 4. Clarification. Attempting to put vague ideas or nuclear thoughts of the patient into words to enhance the nurse's understanding or asking the patient to explain what he means. Example: Nurse, I'm not sure that what you mean. Could you tell me about that again? 5. Reflection. Directing back the effective content of patient content. Example: Patient, I am very angry with my husband. NURSE. It sounds that you are really angry with your husband. What happened? 6. Information. The skill of information giving. Example: I think you need to know more about your medications. 7. Focusing. Questions or statements that help the patient expand on a topic of importance. Example: Nurse, since when did you start taking alcohol? Patient: 20 years. Nurse, how did you start taking it? 8. Sharing perceptions. Asking the patient to verify the nurse's understanding of what the patient is thinking or feeling. Example: You are smiling, but I sense that you are really very angry with me. 9. Theme identification. This involving identification of underlying issues or problems experienced by the patient that emerge repeatedly during the course of the nurse-patient relationship. Example: I noticed that you said you have been rejected by the man. Do you think this is an underlying issue? 10. Silence. Lack of verbal communication for a therapeutic reason. Example: Sitting with a patient and non-verbally communicating interest and involvement. 11. Suggesting. Presentation of alternative ideas for the patient's consideration relative to problem solving. Example, patient, my son doesn't understand my feelings. Nurse, you can discuss this your children so they will know how you feel and what you want. Non-therapeutic THERAPEUTIC 1. Giving advice. Example, if I were you blank. Point 2. Giving false assurance. Example, don't worry, everything will be okay. Point 3. Topic jumping. Example, let's wait on that and talk about blank. Point 4. Interrupting. Example, hold it. 5. Overloading. Example, what's your name? I see you like sports. Where do you live? 6. Showing disapproval. Example, arguing and telling the client is wrong. Point 7. Ignoring. Example, I can't talk to you right now. Conclusion. The therapeutic interaction between nurse and the client will be helpful to develop mutual understanding between two individuals. Interaction is a learning experience for both client and for the nurse, and a corrective emotional experience to the client to modify his behavior. It establishes trusting relationship, wins the confidentiality whereby the client can reveal his thought and feelings openly. So all the nurses need skill in therapeutic communication to effectively apply the nursing process and to meet standards of care for their patients. Thanks for watching.